And I'm in my bush adventure therapy practice, in the work that I do with people, I like exploring that metaphor of how nature and human life can reflect each other in so many different ways and provide pathways for us to locate ourselves when sometimes we're lost a little bit. Go on to the next slide now. One thing that I'll often invite people to do is to just imagine a place that might come to mind for you, a place in nature, and particularly a place that has you thinking, or that you'd enjoy being there if you went there. And so in the next 10 or 15 seconds, if you're watching this at the moment, try and bring a place to mind and imagine what it might look like there. A place in nature. It might be just out your back door or down at a local park, or it might be somewhere that a little further afield. And in your mind, take yourself to that place. And I'm not sure if you've got access to the chat window, but if you're doing this and you feel you'd like to, you can share where that place might be in the chat window, and just that little bit of imagining about where that is and what it might look like there and what it might be like if you were to put yourself in that place. It reminds me that when we get a chance to go into nature, we can bring that nature back to whatever place we like in our minds, and it's a really amazing power that we've got as people to bring those images and memories to mind. Might go to the next slide now, if that's okay. Somebody's put in there, they go to the 12 apostles. That's nice. And rainforest sounds of birds and water sounds. So there's a number of different ways that you could look at bush adventure therapy and what that looks like when you meet it. And one way of describing that we've got up now, which is an intentional use of adventure in outdoor environments for therapeutic ends. A newer way of describing it is a biopsycho-socio-ecological approach to human health and well-being. And I think I said earlier on, it's a really diverse field of practice in Australia. There are people that practice in really local environments, so local parks or really remote environments out in some of the most remote places in the country. And there are people that practice using bush adventure therapy in groups or with individuals. And a lot of animal assisted therapists will also bring their work in underneath this umbrella. But it's a really expanding field at the moment. We'll go to the next slide here. This is another way of thinking about that connection with bush adventure therapy and what it might look like if you're to encounter it. So that most services will have these different elements of nature contact, some sort of physical activity or experiential adventure, social relationships, and a therapeutic frame that encompasses that and provides a safety net around that. It's worth thinking about how we define adventure, though, because that might take you to thinking about really risky activity, and we'd like to broaden that definition of adventure being, if you go back to the root of the word, which is to advent, which is to take a step towards something. That's both an intention and a practice towards something other than where you are currently. And it might also be stepping into an unknown situation that might be unfamiliar and a bit unfamiliar at the start, but progressively more familiar as you encounter that contact with nature. So it's not, we don't see it all as high-end adventure activities, but more the adventures of mind, body and spirit that we can engage in when we go out together into nature. I might go on to the next slide now, that's right. Most programs will have targeted aims, a holistic safety net, and have a really strong emphasis on collaborative design. And opportunities to go through experiences and then reflect on them afterwards and think about how we lay down those memories of experience when we come back from those outdoor places. On to the next slide here, if we can. Over the last, I guess, 50 years or more, there's been a real progression in thinking about health. And if you go back to where it was a while ago, it was a really biologically centered world where everything had to be seen and measured in a physical sense to exist in health thinking. And more recently, that biopsycho thinking about health has been really useful in thinking about that mind and body connection. And in the last couple of decades, particularly the social determinants of health have let us add in that social dimension to thinking about health, and the social determinants that play a part in how we live healthily together. And what we are hoping to do with bush adventure therapy practices and outdoor healthcare practices is to add this ecological lens to the work that we're doing. That brings together the connection between health and the places that we live, and health and natural environments, and the multi-dimensional and multi-directional relationship that we have with the environments that we live in, how that sustains health. So I might go on to the next slide here, if that's okay. And to ask you a question in here, if we thought about this little connection of people in nature here, and I just asked that question: what do you see? What do you notice? What might come to mind about health and healthy relationships in these pictures? And feel free to add some comments about that into the chat window. Interaction, yeah. Feel free to add more comments if you like as we go. Fun and adventure, yeah. Okay, might go on to the next slide here. So I've talked a little bit about what that might look like from one perspective, and another thing to talk about here really briefly is, we'll go on to the next slide, but how to locate that in that health environment. And so there are examples of bush adventure therapy programs that occur across spectrums of interventions, so from prevention through to continuing care. We'll go on to the next slide here. We'll skip through these ones fairly quickly. And these are some of the different experiences I've had in the past with using this sort of work. That's okay. You can go on to the next one. Yeah. So this is another spectrum, I guess, of practice where we can locate bush adventure therapy practices. And so from respite, recreation, enrichment, training and education, they might all fit under that adjunctive therapy banner, where in that respite and recreation end, the intentions might be different to a program that's really aiming to treat particular things, but they nonetheless really important to locate within that spectrum of health practice. Head on to the next slide now. Yeah. Sometimes we do engage in some of those more adventurous activities like climbing and caving. Great. And so bush adventure therapy experiences can often be across these different, encompass these whole range of different, I guess, types and depths, and from little one-off tasters that might be an hour or two in local parks, whole day activities, sequences of activities that are lined up across weeks or months, overnight experiences where we're going out camping or journeying through the bush. Some might be residential and some might be really well integrated into the life of a community. And there's examples of all of those different types of bush adventure therapy experiences. Just looking at how I'm going for time here. So there is quite a lot of evidence to support bush adventure therapy and why going out into the bush, into nature, is really important for our health. And I'll let you read through these. So I'm not just reading off the slides. But it's worth noting now that the world of neurophysiology and neurobiology is really giving us some fascinating new language to think about the positive effects of nature contact and bringing together those different aspects of small, safe social groups and going out and using embodied practices and doing that in nature. There's some really hardline evidence that supports all of these statements here, but goes to another level of thinking about how it can support recovery from mental health in terms of supporting neurological reorganisation and that idea of brain plasticity. So there's a lot of new research that's coming out that'll be really fascinating over the next few years. Okay, might go on to the next slide here. One of the recent meta-analysis, so really big studies that brought together a whole range of evaluations in this field, suggested that bush adventure therapy can be placed alongside really gold standard practices like CBT and hold its own in that space. And further to that, those the changes that occur as a result of bush adventure therapy experiences seem to be maintained over the longer term, really quite effectively with a whole range of groups. Interesting, in Daniel Bone and James Neal's study, they also suggested that while bush adventure therapy is really good with working with younger people, the effect size increases with age, which is really interesting idea too. So we'll go to the next slide, and I might finish up there, but please, I've got some more that I can draw on if you're interested in hearing more specific examples of bush adventure therapy practice that I've been engaged in over the last couple of decades. Thanks very much.
Perfect. Thank you so much for that presentation, Ben. It's really fascinating to hear just how much, I guess, the science supporting, you know, all the great work you guys do with bush adventure therapy is really been accelerating, you know, in recent years and is continuing to do so. So I'll now move on to introducing our next guests for the day. So I will just get that presentation up shortly. I would now like to introduce Dave Weeks and Sophia Sugravo from Outdoors Inc. So I will first introduce Dave. Dave has 25 years of experience teaching and working as an outdoor educator with a wide diversity of groups. Passionate about outdoor adventure, Dave has a particular interest in the connection between our mental health and contact with natural environments. Having worked for many years now in the community mental health sector, Dave has developed an intimate knowledge of the difficulties and concerns of people living with mental illness, in particular that of stigma and the lack of mental health literacy in the wider community. Sophia began her journey with Outdoors Inc. in an administrative role and went on to complete a Master of Public Health degree from the University of Melbourne after developing an interest in mental health promotion. She was promoted to the Health Promotion Coordinator role upon completing her studies in 2017. She has an interest in how The natural environment supports recovery and enhances wellbeing outcomes for participants. Could you please now welcome Sophia and Dave to come and speak?
Thank you, Andalee, for the introduction. Sophia, have you got the PowerPoint? Unfortunately, I can't see. I'm going to rely.
We can see your PowerPoint now, yes.
Beautiful. All right, we'll make a start then. Thanks also, Ben, for your presentation. That was great. And good afternoon, everyone. As you can see on the screen, my name is David Weeks. I'm Program Manager for Outdoors Inc. We're an outdoor adventure and recreation program working in the mental health sector in Melbourne, Australia, for those overseas visitors. Before we hop into the main topic of our presentation today, I was actually hoping to introduce you to a very small urban park across the road from where I live in the outer east of Melbourne. But unfortunately, it's raining cats and dogs out there today, so I can't do that. I don't think my computer would like it. So I'll just tell you a little bit about it. This small park has a little section of it that's a bushland zone designated exclusively for native vegetation. When I say small, I mean it's like 40 metres wide at its best and maybe about 150 metres long, so it's pretty small. The reason why I was going to introduce you to this park is because for the last few months I've been visiting this little bushland zone on a fairly regular basis, and I've not only grown fond of it, but more significantly, I've actually become quite grateful for it. Why would I be grateful for such a tiny little, otherwise insignificant urban park? Well, for those of you who aren't from Melbourne, but I'm sure you're no doubt aware, us Melbourneites have been in lockdown pretty much since the end of March of this year. And one aspect of the lockdown is that for a good proportion of that time, we've been restricted to a 5-kilometre radius of our homes. Without being dismissive of the many other consequences lockdown brings, this factor of lockdown alone has made it particularly difficult in so many ways for those living in Melbourne metro region, not being able to see friends, family, not being able to get away from the city, and just two examples that come to mind. If I can be totally honest, before March of this year, I hardly went over to that park, and I've lived here for almost a decade now. To me, it was just a tiny little park across the road with a kids' playground in the middle, without a doubt nicer to look at than a row of houses, but not something I ever felt particularly drawn to explore. I had plenty of other far less urban, far more expansive options, sort of like the backdrop that you see behind me, within easy distance of where I live, just not within 5 kilometres. So the lockdown certainly changed all of that for a lot of us. And for me and for many others, not just in Melbourne, but in many other cities around the world that have faced similar lockdowns due to this COVID pandemic, urban parks such as this have become, in a way, a urban oasis, somewhere to chill out, somewhere to connect with nature, to de-stress and re-energise. If anything, lockdown has awakened in us the importance that even these little tiny urban parks have for the health of our community. So before Sophia continues and talks a little bit more about Outdoors Inc., I'd like to show you a very short, tongue-in-cheek video, more of an ad out there on the web. Some of you might have seen it, perhaps, but in many ways encompasses the philosophy of Outdoors Inc. So I'll hand it over to you, Sophia.
Do you find yourself longing for the apocalypse? I did. I was looking for a reason to live. Hi, Are you feeling tired, irritable, stressed out? Well, you might consider nature.
From the people that brought you Getting Outside comes prescription strength Nature, a non-harmful medication shown to relieve the crippling symptoms of modern life.
Nature's recommended for humans of all ages, and it's great for pets too.
Nature can reduce cynicism, meaninglessness, anal retentiveness, and murderous rage. In clinical studies, Nature is proven to decrease work-induced catatonia.
Caution, nature may cause you to slow down, quit your job, or seriously consider what the you're doing with your life.
If you are overly cynical, jaded, or emotionally numb, you may need to increase your dose of Nature. Do you have trouble being even mildly uncomfortable? Nature may not be right for you. Side effects may include spontaneous euphoria, taking yourself less seriously, and being in a good mood for no apparent reason.
So ask your doctor if nature is right for you.
Thank you everyone for joining us this afternoon. My name is Sophia and I am the Health Promotion Coordinator at Outdoors Inc. And as you can see from that cheeky advertisement, it's basically promoting contact with nature as a prescription for good health and how it can benefit anyone and everyone. There is long-standing evidence that suggests that outdoor environments have restorative benefits for health and well-being. Some of this work dates back to the 1990s by American psychologist Stephen Kaplan and the attention restoration theory, which assumes that nature has the ability to help people focus and improve their concentration. But there's more recent research that has been conducted by Parks Victoria, and this was a literature review that was published in 2015, and its focus was on the importance of parks and green space and the association with positive health, mental health and physical health. And it explored spaces that have a healing effect, and that they may not only will they provide a healing effect, but they may provide a stronger insight into your own well-being, and even exposure for short periods of time can create meaningful personal benefits, as well as acting as a protective factor against mental illness. At Outdoors Inc., Dave and I witness these benefits on a daily basis via the participants who attend our programs. So who is Outdoors Inc? We are a not-for-profit community organization that promotes mental health and well-being through outdoor recreation and adventure activities. We offer a diverse range of programs from leisurely activities that may be day trips consisting of a few short bushwalks within an hour's drive from Melbourne, or yoga programs that go for 5 days and are located in the Grampians. We also offer programs that are a little bit more challenging and adventurous, such as rafting on the river in remote locations such as the Murray or the Middle River, and we also go rock climbing and abseiling in Mount Arapiles. We primarily work with people who are at risk of developing mental health issues or who have a long-term chronic health condition. Over the years, we've worked with many population groups, including youth at risk, senior citizens, multicultural groups, refugees, and we've also run a number of other programs in partnership with other community agencies. And I'll hand it over to Dave to give you a little bit more about the history of our programs.
All right, just have to unmute myself. Thanks, Sophia. So Outdoors Inc. Was founded in 1987, as Sophia said, as a not-for-profit, community-managed mental health organisation, and the first of its type in the mental health field in Australia. It was created by people working in mental health who were interested in how contact with nature and engaging in outdoor adventure activities could help break the the revolving door cycle of reoccurring mental illness. And that is the pattern where a person experiences an episode of mental illness, goes into hospital or a clinic, is looked after, maybe gets stabilized on medication, comes back out again, then experiences another episode, and back in they go. And it's this continuous cycle that inevitably leads to disability. So the name Outdoors had the deliberate double meaning of not only using the outdoors and outdoor activities as a medium for recovery, but also in the context of getting out the door of the home or hospital to engage in activities that enable a sense of success and to participate in the life of their community. In my mind, Outdoors owes its longevity and its success to two things. The first is it being based on a psychosocial model of health, where one values engagement, social interaction, participating in things, not being isolated, physical activity, doing things with other people together, and learning new skills, amongst others. And the second is the sense of community around which Outdoors is built. Some of our participants have been with Outdoors Inc. Since the early 1990s, over 25 years now, and far longer than any of the actual staff. And when asked what it is that's kept them engaged with Outdoors for such a long time, it's not because they've been living in this cycle between wellness and mental ill health for such a long time, and then using Outdoors as a means of recovery. But invariably, it actually is more to do with the sense of belonging they've forged with the Outdoors Inc. community. And they've found that participating in the life of their community and the opportunity to get into nature in a safe manner helps maintain their good mental health. They've found what works for them. And on several occasions, more than several occasions, I think I've heard participants mention that getting away on an outdoors program is for them worth 10 visits to their doctor or psychologist. So, give it back to Sophia.
So I did let nerves get the better of me in the previous slide, and I missed out on an important point. So I'll share that with you now. One of the things that I'd like to point out is that our program is not therapy focused, but participants have described that it's therapeutic for them. So our goal is to support access to nature-based activities for our participants and to provide a safe space to help them build positive social connections and experience an outdoor adventure in a very safe environment. Over the years, Outdoors has obtained a great deal of anecdotal evidence that supports that demonstrates that our programs have facilitated participants' personal recovery. And the way we do this is every time we ask participants to attend an overnight, they're invited to attend an overnight program, they're required to attend a planning session before they come along. That's usually a week or two before the program itself. It provides a great opportunity for them to meet the other participants, to develop a schedule of the activities that they have options to participate, and they're involved in meal planning, and they work in groups on certain tasks. So there's that team building element as well. At these planning sessions, we provide participants with a pre-program survey, and we ask them what their goals are for the week, how they're feeling, and what they're most looking forward to. At the end of the program, we give them the survey again, and we ask them to reflect on whether they've achieved those goals and how they are feeling now that they've completed the program and what they enjoyed the most. And when we look at this information, there is a common theme in how they're feeling. So most participants do report an improvement in their mental well-being. And some of the words that they use to describe how they're feeling upon returning from a program could be relaxed and happy, or I'm feeling motivated to continue positive activities at home. Or they might be tired, but I feel good, or I feel a sense of accomplishment, I feel resilient. The fresh air really helped me. In relation to their goals, most participants come along on the programs to develop their social skills, and the strategies that they use to build those is they feel that the teamwork element of the programs has helped them develop those social skills. As well, they set strategies for themselves to speak to more people than they normally would, or to participate in active listening when they're having conversations with the other participants. And of course, having an outdoor adventure is what most people come along for, and it's not always has to be an active, something like rock climbing or abseiling. It may just be completing the duration of the entire walk or participating in every single activity. And these benefits are consistent with the findings in the research literature that's available. And now Dave is going to speak a little bit more about the mental health benefits that our participants experience.
Have you got that infographic up, Sophia?
Yeah.
Cool. Sorry, I can't see it. So, all right. Disclaimer before I start. This infographic you're seeing is from a website known as Challenge the Storm. It's an excellent website dedicated to supporting those affected by mental illness. I highly recommend going to visit it, and we'll give you the link at the end of the presentation. It's also a really nice summary of the mental health benefits of spending time outdoors. Sophia and I chose this graphic because these are the things that we hear from our participants time and time again in relation to participating on outdoors trips, be it a day or a 5-day trip. And it also links really well with the theme Sophia presented in the previous slides. So for example, Sophia noted that participants report feeling an improvement in their mood, more relaxed and restored upon completing a program. And this links really well with these points you see on the screen about reducing mental fatigue and mood elevation. I'd like to share a quote, and it's the next slide. I'll just read it out for you, but you can see it yourself. I've noticed over the years, going away with people with mental health issues, we've all said the same thing, that there's something peaceful and spiritual about being out in the bush. A lot of people find it exceptionally good for their mental health. I know for me, being away from all the artificial stimulation, like even a TV or a fridge, I sleep so well. I'll hand it back over to Sophia to continue.
Yeah, and so back to that mental health benefits graphic, another one of those points are that contact with nature helps fight depression and anxiety. And many of our participants have that depression and anxiety. And here it talks about how spending time in nature mitigates the symptoms of those experiencing these conditions. And I'd like to share another quote by a participant that they recently shared with us upon returning from a program. And I feel it really summarizes this point quite well. I think when you're walking through the gums, the trees and the forest, it puts your life in perspective. I mean, it gives you the time to think. There is silence if you want, but also when you look at nature, if that's your spiritual values, it certainly puts your life in perspective. And to end the presentation, we'd like to share a video of Outdoors Inc. that was filmed a few years ago, but it basically summarizes all that we spoke about today. And I feel it will give you a snapshot of what outdoors programs are like and from a participant's perspective. So I'll share that with you now.
Flying in the dark, I know you are awake. I will not give in, I will not give in. Pulling faces and admitting not a thing. I will not give in, I will not give in.
want the donor to do is just keep a little loop in the rope at all times, okay, the whole time, not on the ground and not straight, so that I'm actually doing my job and I'm not being obstructed by it. Outdoors is a not-for-profit organisation that works, does outdoor adventure programs for people experiencing mental health issues.
We take people outdoors to do fun activities. It's giving them a break from the routine in Melbourne.
We do a range of adventure activities and creative programs, ranging from rafting, rock climbing, bushwalking. Activities we like to do are activities that get people working together, engaging with others.
I'd say my favourite was rock climbing because it's a bit of a challenge. I really didn't think that I could do these activities. And the feeling of satisfaction is just, yeah, you can't compare it to anything else.
So we also do creative programs at Outdoors, activities like painting, bush art, music programs.
When I first came to Outdoors Inc., I told them I was an artist. A lot of people, when they say, oh, I can't do art, but like what's stopping them is the fear and the anxiety.
The aim of Outdoors is to get people out the door of their home, out of the hospital, to engage with other people, to improve their mental health through interacting with others.
So they come out here and they have a group of people that, you know, understand where they're coming from and are really supportive. So the social aspect is a big thing as well.
They're in a place where there's no stigma attached to their mental health. So they're working with people who experienced similar things to them.
Of course, I can relate. We can all sort of relate to each other. We've been through similar challenges and dramas and made it through.
Hopefully it's something they can bring back to the city, and if they're going through a tough time, maybe mentally, they can reflect back and think, well, I got through it that day, I can get through it today.
It's challenging me to come out of my comfort zone, and I recommend it to anyone, and I'd probably do it again myself.
It's awesome fun, Outdoors Inc. It really has changed my life.
Thank you for coming along today. We hope you enjoyed the presentation, and of course we welcome any questions you may have. Thank you.
Perfect. Thank you so much, Sophia and Dave, for that excellent presentation. I found that video at the beginning of it all quite hilarious, honestly. It's good to have a nice, bit of comedy to start things off and loosen everyone up. So we're now going to go into a Q&A panel with Dave, Sophia, and Ben. So if anyone has any questions for any of them, please put them in the chat or the Q&A box. And we'll start off now by reading what questions we have so far. So we have one comment here, amazing work. One of the questions is social prescribing getting bigger in Australia? It seems to be so big overseas, but still getting going here. I think that is in reference to, as in like kind of social prescribing, as in the prescription of, programs like these, yeah.
So the majority of our referrals come from other community organisations. Not often do we receive referrals from GPs or psychiatrists. That is when we start operating programs again. That's something we'd really like to look into. I recently attended a webinar on social prescribing, and so I do have like a to-do list to get our name out there more so with GPs, and how I know the Primary Health Network in the northwest of Melbourne, which is where we are located, did a project in social prescribing in partnership with another community mental health organisation. So I'm really looking forward to having a chat with them about how we can get our name on the list and have our service as part of something like that.
I can add to that a little bit. Thanks, Sophia. I'm also part of a little group that's an arm of the Australian Association that's looking at public health policy and research and practice development. And we're networking in with groups of GPs that are really interested in green prescribing. And recently we hosted a nature and health symposium. One of the presenters from the States there has set up a system for doctors to use that they can locate organisations like Outdoors Inc. and a whole range of others to actually give green prescriptions and nature prescriptions within their practice. And so as a model, there's a cohort of GPs in Australia that are looking at the frameworks that and examples of that are going on in the US, and particularly the UK has got some really interesting work happening at the moment in that area. And so I think that's another area that we'd watch this space and see. I know Parks Victoria are also really heavily behind that sort of action as well. So watch this space, and we might see that expanding exponentially in the near future, I imagine.
Certainly. That's great to hear that it is growing, because I think, it's a shame that we have such incredible programs like all of yours, and yet so often so little people actually know that these programs are there on offer, which is such an important part of it as well. Another question is also, what are some relevant qualifications to work in this field of outdoor therapies, therapeutic gardening, adventure therapy, etc.?
That's an interesting, have I got my, yes I have. That's an interesting question, and can be a bit of a debate across the field on what, as far as outdoors perspective goes, we employ workers who are outdoor education qualified, not necessarily psychology or social work qualified, and we work the way we manage our programs and the risk management of our programs, especially in regards to the participants, is there's an intake process that is managed by an intake worker who is actually mental health social work qualified in that initial process. And also we work whenever someone comes on a program, we liaise with a professional that they're already engaged with, whether that be a psychiatrist or a social worker, some sort of professional support person. And that's a sort of a mandatory first step in the process when they come on overnight programs with us. So it's not that we ourselves are actually psychologists, but we are definitely working alongside psychologists that individuals have.
Certainly. And then Ben, can you speak to how this might differ perhaps within your organisation as well?
Yeah, so speaking from the Australian Association for Bush Adventure Therapy, as a national body that brings a whole range of different organisations and practitioners together, we've set up an ethical framework that guides organisations to think about how they structure their practice in safe and effective ways. And while in Australia there are no discrete training pathways towards being a bush adventure therapist or an outdoor therapist, there are we put an emphasis on having a team of practitioners who have got the necessary skills to make sure that the practice is safe and effective. So exactly like Dave described there, the range of different experience within their staff team. It will vary from program to program depending on what the needs of people who are accessing that program look like. And so very often people who start out in the field will come from a social work or counselling background or an outdoor education background and team up with other people who have got diverse qualifications. A 2007 study that did a bit of a survey of bush adventure therapy practices and outdoor health practices in Australia identified 240 different qualifications that staff surveyed had. And so you can see it's a really diverse range of qualifications that people come with. There is work being done at the moment to develop a discrete training pathway that would provide access to somebody that wants to work specifically in this field and develop a range of skills that respond to that.
That's really great to hear. Thank you all for your answers on that. We've got 2 more questions before we'll wrap up the Q&A session for today. So the first question is, can walking in nature encourage people to talk about their concerns, worries and anxieties more than normal? And if so, is there any specific research on this that you have to mind? Obviously, if you don't have anything that comes to mind immediately right now, that's perfectly fine, and we can actually send out any links that you want to share following the event.
I don't know much about the research, but as you mentioned in your introduction, I started in an administrative role when I started working with Outdoors Inc. And I remember when I would sit at the front and in the morning before participants would go on their first day program, it'd be very quiet and people would come in and just be like, hello. And then at the end of the day, when they would return, there'd be a lot more chatter. And I did notice when I've gone on a few programs myself is that when they were out in the bush on those walking the tracks and out, that's when they would connect more so than over morning tea, say, or in the afternoon. So I think there has been a little bit more research, but don't quote me about people being able to have more deeper discussions in the bush, but I could send you something afterwards so you can share with the audience. But on the spot, I just can't think of which study that was.
Just from I guess a practitioner sort of working in the outdoors with people who are experiencing mental illness. For one thing, our program is focused on ability rather than disability. When people do come on our programs, they're generally well, and that's part of our risk management process. They're well to come on program, but naturally they because they feel it's a safe environment and it's a safe, not just physically safe, but also emotionally safe environment. They're alongside people that have actually had similar experiences in life to them, and that just makes it a very safe place for them to be able to share. So in a way, it's a natural thing for people to feel safe to be able to share what they've been going through in life, and we allow discussion, but we don't actively engage in that discussion. We won't bring that up unless we let participants actually bring that up themselves if they want to. But there is a caveat, I suppose, to that, and that is, as I mentioned earlier, we're not therapists, we're not doctors, so we're also careful not to go down the rabbit hole, so to speak, and open up a can of worms if something is something for an individual is really perhaps more than what we would be able to actually handle in that conversation. So that's the perspective from outdoors. I'm sure Ben might have something perhaps to also add.
Yeah, so certainly I would agree. As a practitioner, I've observed going out with people into the bush that it very quickly opens up a space for conversations that wouldn't naturally happen. And outside of that space. In terms of research that supports that, some of the things that come to mind are around some of those pathways, nature pathways to reducing stress. And so one concept in lay terms is thinking about how the cognitive part of the brain can shut down when it's under a higher stress load. And so when we're, certainly there's been some really hard science and research around the field of forest therapy, and some of the reduction in stress and the increase in cognitive capacity in forest therapy examples, which has been really clearly demonstrated, would have that correlation of making conversations at that cognitive level more readily available to people in that environment. So I'd say there's some indirect research that supports that, but I couldn't say if there's direct research that suggests that from my knowledge.
Perfect. Thank you all for your answers there. And of course as well, if you have any additional articles or anything like that, any research that you would like me to share with audiences following this, just email them to me and I will pass them all to all our registrants for today's event. The last question we've got before we move on to our little ends challenge for everyone who's still on is just surrounding, so we've talked about all the great benefits of spending time outdoors, and you've all touched on this a little bit, but we are currently in the midst of a global pandemic and many of us cannot really go very far outdoors at all. And, you know, especially even in some instances where people are required to quarantine for whatever reason, they will be locked inside a room for about 2 weeks. So I was wondering if you could talk a bit about how you think people can actually get these benefits of contact and interaction with nature in this very bizarre and new landscape we find ourselves in 2020.
Yeah, that's a really good question. Some of the friends that I've talked about have measured their little 5K bubble that people have been in Melbourne around them. The first thing they did was to mark out all the little green spaces that are within that 5 kilometre bubble. And like Dave was talking about earlier, to connect in with those and explore those in a whole range of different ways. I'll hand over to Dave. I think he's wanting to talk more about that too.
I was just going to say, I'm putting my hand up because I'm one of those people.
Yeah. Parks Victoria are actually putting together a whole bunch of guided virtual forest walks that people can access online too. And there's a lot of research that goes back decades and showing that even a view of nature and that virtual immersion in nature can have some of those health benefits and some of those mental health benefits that immersing yourself in nature can have as well. So accessing things like that are becoming much more readily available through the internet now is something that I definitely recommend.
One of the things we didn't mention, of course, with this lockdown is our program obviously we haven't been able to run our programs. I've been working from home myself for the last six or so months. And of course, that means all our participants have not been able to engage also in any of our programs, which is a great shame for us. But it's nothing we can do that at the moment. We're hoping very shortly, with the easing of restrictions, that we'll be able to introduce programs once again. But yeah, just to reinforce and I answer the question, as Ben actually said, finding small areas that you wouldn't otherwise necessarily even consider. Urban parks, if you have access to them. And as I said, I feel very fortunate that I actually even have a tiny little urban bushland zone near my house. And I've spent so much more time exploring just that tiny little zone. And and being grateful for the contact with nature that I've just before never had, wouldn't have even considered that little spot. So the backyard, gardening, there's, if you've got that sort of access to those things as well. There's even research to support the idea that even looking at photos of nature is beneficial to your mental health. So there's a range of things. Any way we can contact nature, whether it's visually or physically, is beneficial.
Yeah, thank you so much for your input with all of this, guys. I can definitely attest to the impact for not being allowed outside has on you. I was in quarantine for about a month earlier this year. And, you know, the smallest things, even a friend dropped off a pot plant at the front of my door for me to have inside of me in quarantine. And I set that up and I cracked open my window so I could kind of feel a bit of wind on my fingers if I stuck my hand through the outside. And I know that sounds, you know, very desperate, but even that just helped so much, being able to see outside my window, look at the weather outside. I got a few rainbows whilst I was in there, which is always great. So whatever way you can, increase that connection in this time, it's so worth it, even if it is just having one little pot plant in your apartment with you. So thank you so much for participating in the Q&A. Now, with this in mind and everything that we've learned today about the benefits of spending time outdoors and connecting with nature, we've got a little challenge for everyone that is attending today. So I'll just get it up on screen. The challenge for everyone is, now we know everyone's got a big variety of nature and options for that they've got access to. So whatever you've got access to, whether it's a tree on your nature strip, a pot plant in your house, or even you're able to have an adventure in a nice nearby park, like Dave was describing. We want to challenge everyone here to go out and start putting this into action today, or maybe tomorrow if you don't want to get drenched by the rain. That's, you know, I understand that choice. And just take a photo of you outside, putting what we've learned into practice, and just write a caption, post it somewhere. And if you post it on social media with the hashtags mental health matters, outdoors and mental health, and challenge accepted, and tag our social media channels, we'll make sure to share it on our social media feeds. And hopefully this can work to encourage your family and friends to do the same. Mental well-being starts with small actions each and every day, and to try and help take care of our minds. So let's get going outside for our mental health trending in 2020. So you've got an example up on screen there, just with an example caption and tags and a photo. And then on this screen, you can see the list of accounts you can tag depending on what social media platform you're using. Once again, this will all be sent out via email, so you will have access to these examples. And with that, I would like to thank all the attendees, and I'm looking forward to seeing everyone's photos of their mini adventures in their suburban areas. I would like to thank our guest speakers, Dave, Sophia, and Ben today. We do have some engraved pens as a gift of our appreciation for you speaking today. Obviously, I can't give them to you here today, but we imagine they will arrive in the post at some point eventually, depending on how the postal world is working at the time. We would also like to thank our board of directors and our whole team that has been working to put together this event and the entirety of National Mental Health Month. And I wish you all the best of luck for a great day ahead. And I hope you enjoy whatever nature you can get your hands on today. Thank you so much for joining, everyone, and we'll see you next time. Bye.
See you later, everyone.
Bye.